One of our patients had been wearing dentures for almost 40 years. And we did teeth in a day on him, and I knew the bone was only in the front, and having back teeth meant he was gonna break some screws every now and then. And sure enough, every couple of years, he breaks a screw head off, and we go up to the office, and it was on a Saturday. And he said, "Doc, do you know why I would do this procedure again tomorrow?" And I said, "Why would you do this again tomorrow?" He said, "Because these are my teeth. I don't remove a body part to brush them. I don't take out a body part to go to bed. These are my teeth. I brush my teeth." And a little tear, there's a big scary guy, a little tear formed in his eye, and it made me understand a little bit what people are going through with dentures, with something that you take in and out of your body. These are your teeth, and you brush them as if they're yours, and you care for them as if they're yours, and you don't have to deal with removing a body part to go to bed and the embarrassment and dehumanizing effects of that.